Ready? Look at this.
Okay, hello everyone and welcome to our webinar. We're going to be hearing from Dr. Sairupa Krishnamurti. Dr. Sairupa, can you turn on your video? Amazing, and I'm gonna ask you to unmute. Hi, Dr. Sairupa, can you hear me?
Yeah, I can hear you. Can you hear me okay?
Yeah, okay, that's great. Hi everyone, so welcome. I want to introduce Dr. Sairupa, who is an amazing naturopathic doctor who works with us at Oral Medicine and Wellness Clinic. I was super excited when Dr. Sairupa offered to do this talk because this topic is something that the topic of natural ways to enhance fertility, plus with the Ayurvedic perspective, is something that a lot of our patients ask for. And I mean, I know certainly that I get a lot of clients and patients who are looking for ways to conceive. And so I always ask you, Dr. Sarupa, for advice as we go through the process with each of them. So I was really excited to be able to do this with you today and to hear from you, because I think that this is what a lot of folks are looking for. It's great to see all of you joining us. Thank you so much. Just some points of administration. Like if you have any questions, we're just going to ask that you ask us in the chat, and I'll try to monitor that as we go. So if you can't hear Dr. Sairupa for any reason, just send me a note in the chat and we'll make sure that you'll be able to hear her. Great. So
great, yeah.
I'm going to start by introducing a little bit about Dr. Sairupa Krishnamurti. So let me pull that up real quick. So Dr. Sairupa is, as many of you know, a licensed naturopathic doctor and Ayurveda practitioner. She has a general family practice and a clinical focus in reproductive health, fertility, pregnancy, postnatal care, pediatrics, and mental and emotional health. She received training in Ayurveda from the Center of Ayurveda and Indian Systems of Healing, and obviously her naturopathic doctor degree at the Canadian College of Naturopathic Medicine. And for 2 years, Dr. Sairupa worked full-time in Singapore at an integrative clinic, and that's where she was really able to cultivate her skills working with the perinatal and pediatric populations. She still works with folks all over the world, and I know that we get such great feedback from your clients about the kind of work that you do. So we're very fortunate to have Dr. Sairupa here today, and I'll let you take it away and start sharing.
That's great. Just to check in, everyone can hear me okay? just let us know if you're not able to hear me for any reason. Dr. Julie, thank you so much for the intro. You know, I don't need to say this again, but so grateful to be working with Orem Clinic. And it's great that we were able to put this talk together, because I know it's something that we've talked about doing for a while as well. So it's nice to be able to share. And I did see a few participants' names that came up that I'm so happy to see your name, because it's people that I've known in the past or worked with in the past, or are friends or colleagues of mine. So really nice to have you here. And yeah, I'm excited to kind of get into talking about Ayurveda and the approaches to enhancing fertility. So just to start off, I'm going to talk a little bit about my approach. And again, if you've heard me speak before, it's a little bit of a repeat story, but I do like to share a little bit about how I came to Ayurveda and naturopathic medicine. And that's because, you know, many of us that follow these professions or want to get into these ways of healing is because we're working on our own health. And for me, that was through eczema. And, you know, I had really severe eczema. I throughout my childhood and my teenage years, you know, went to see dermatologists that would just, you know, put the Band-Aid solution on it. And grateful at the time that I had that as an option, of course, because, you know, can be helpful, but was never really getting to the root cause. But then when I was able to seek out Ayurveda and naturopathic medicine, really, really helpful to understand that there was a connection between my gut health and also stress levels and emotions and what was happening on my skin. So yeah, that's you know, many years ago now, and I'm really grateful that I was able to find and connect with these medicines. I want to talk about Ayurveda and just define what the name means for those of you that might not be familiar. So Ayu means life, and Veda means wisdom. And so Ayurveda, as an ancient philosophy, some say it's 5,000 years old, from India, from South Asia. And this particular medicine gives so much guidance on your own personal constitution. It gives a lot of insight on how you are also a part of nature, and how your constitution, when brought into balance through diet and through herbs and through lifestyle, can really promote longevity and well-being. So with naturopathic medicine, it's a primary care. And, you know, that means I do conventional lab testing. I do Western diagnosis as well. And for me, my approach is integrating both. And so those of you that might have seen me in a consultation, I do use both constitutional analysis, understanding again the mind, body, energy type that Ayurveda provides us with understanding. And through also taking the naturopathic approach, which is looking at what might be happening on a physiological level through lab work and lab testing, and then providing nutrients through supplementation if needed, as well as using herbal medicine. Okay, so that's a little bit about my approach. So I just want to share the learning objectives for today's talk. So I hope each of you gain a holistic perspective on fertility. Maybe you already have some knowledge of fertility and kind of gaining more of a broad understanding from Ayurveda and a holistic perspective. To learn practical tools to also nurture your own fertility. And I'd also like to share some important blood work to understand your reproductive health as well. And, you know, this might be lab testing that you're familiar with, and that also you might not be familiar with as well. Sometimes when it comes to lab work, naturopathic doctors tend to view the ranges in a specific way that might be different from what a GP looks at. So I wanted to highlight some particular lab work that's really specific to fertility as well. So the reason why I wanted to share this talk is, yes, a lot of the people that I work with are going through wanting to conceive and wanting to prepare for conception, or they've been trying to conceive and haven't yet been successful yet. And some of the causes of infertility right now, I just wanted to share that it's generally like 1 in 6 people, 1 in 6 families that might be experiencing infertility in Canada right now. So it's quite a significant number. And this number has grown a lot within the past 20 years to 30 years. And it's such a mix. It's both related to the uterus, the ovaries. It's also related to the sperm. And it could be because there's a heightened toxin burden in our environment. Maybe it's through pesticides in our foods. And it also could be related to heightened stress as well. And Ayurveda provides, these ancient, traditional guidelines that offer us a perspective that's really holistic, to understand that fertility is actually a day by day and everyday experience where we're working on our whole health. And it's not just like looking at ourselves as a separate, or our systems of our body as like separate from each other. We're really working on the whole of ourselves as best as we can to promote fertility. So generally with infertility, I also wanted to share a bit about the definition. So usually what is defined as infertility is the inability to conceive, or frequent miscarriages, or inability to hold a pregnancy to term. The inability to conceive is usually before the age of 35 if you've been trying to conceive for up to a year. And then if it's over the age of 35, it could be 6 months after trying. And if you haven't been able to conceive after 6 months, then sometimes fertility doctors will use the term infertile, or infertile of unknown origin. Okay, so that's some of the terminology there. So Ayurveda provides these elements of conception. There's 4 main elements. Number 1 is timing. So this is looking at the timing to conceive in your life, and also the timing of ovulation. And then I know there's a few Ayurvedic practitioners that are at this talk, so I wanted to say there's also some also seasonal guidelines, of course, and looking at the spiritual aspects of conception. And number 2 is the field. So this particular field refers to the field in which the embryo will be implanted. Okay, so we're referring to the uterus. We're referring to having a free flow in the fallopian tube, so there's no blockages there. And we're also considering that there's no growths in the uterus or on the ovaries. And we're also looking at number 3, which is healthy and nutritious fluids. So this is really focused on the nutrition of the body and of a healthy menses as well. Okay, and then lastly, it's the seed. So as we'll come to see in this presentation, in this talk, the seed is, what we should be focusing so much on. For sure, this is such an important component of conception, both the sperm and the ovum. And to really take care of the sperm and the ovum, we need to be caring for our whole selves as well. Okay, so I'll go on to describing each. So for timing, what I always recommend is to know your fertile window. Okay, so knowing your menstrual cycle. If you're someone that menstruates, knowing your menstrual cycle, really getting to know how many days your cycle is, and the timing of your ovulation. Okay, so what I usually recommend nowadays is actually just getting an app on your phone and then putting in the information there so you know how long your cycle is. Sometimes these apps will actually give you an idea of when you're ovulating as well. But I do want you to get familiar with your own personal ovulation, your own ovulation signs. Okay. And for some people, this might be a twinge in one of the ovaries. You might feel a little bit of cramping. Okay. And then you also might notice changes in discharge as well. I'll describe that more in a little while. And if you're not regular in your cycle, and if if it's a long cycle, if you're experiencing bouts of absence of your period completely, it might be helpful to actually take your temperature every morning. It's called basal body temperature. And you would get a specific thermometer for this. Take it first thing in the morning when you wake up. And it has to be after having a good sleep. And then measuring this every day and tracking this over 3 months will actually help to show that there's a change in your temperature. And this identifies when you ovulate. I'll share a little bit more detail shortly. Timing also refers to in Ayurveda as the timing in your life and your life circumstances. Okay, so traditionally this would mean, things are really calm in your life, less stressful. However, we know that that's not always realistic. That's not always realistic, but I like to also reframe it as, what you're doing to care for yourself, whatever self-care practices you're engaging in, whatever practices that are helping you to feel resourced and resilient and strong, and how that also impacts how you feel despite the stressors that might be going on in your life. If you've already had a child, then it's actually recommended to give a space in between, and that's to rebuild your nutrition as well, or your dhatus, which is a terminology for some of those that might be watching that are Ayurvedic practitioners, your tissues, okay, your dhatus, your tissues of your body. And it's recommended to actually have a 3-year space between children to rebuild. So this graph that I have up here, I just wanted to give an example of what a basal body temperature tracking might look like for a month. Okay, so I want you to see that right in the middle, there is a spike of temperature. It usually would go up 0.5 degrees. And this is indicating that about 48 hours before you ovulated. Okay, so while this isn't necessarily useful for targeting a day of conception, it is useful for tracking over 3 months and knowing and understanding that you are having changes in your body temperature indicating ovulation. Okay. In Ayurveda, it's recommended that you would, try to conceive for 3 days around the time that you're ovulating. However, this would always change based on constitution, based on what's happening in the person's life. It might be suggested to only try 1 time as well. And of course, for those that might be using reproductive technology, I definitely understand that it might not be realistic, to of course, time things in a particular way. All of this stuff would be tracked by your fertility clinic based on your ovulation. Okay, and Ayurveda also can go alongside so well with IUIs and IVF. And I work a lot with folks that are going through these processes as well. Okay, so this is basal body temperature. And just another note is that you do have to get a specific thermometer as well that has a 2-point decimal on the end. And it should be digital. So this is an illustration of what your discharge actually looks like at ovulation. So this is around your most fertile days. Okay, so for women, for people that are ovulating, then this would be a stretchy type discharge. If you were to take it in between your fingers, it would be an egg white color and it would be stretchy about an inch, maybe even a little bit more. This is a great, great sign that the fluids of the body are supportive for the sperm. Okay, next we're talking about the field. So again, this refers to where the implantation will take place. So if there is a history of fibroids, of endometriosis, of ovarian cysts, of anything that could be contributing to a blockage of flow, anything like this, it can affect fertility. So part of learning about fertility and promoting fertility is how you care for this area of your body as well. Addressing PCOS, addressing endometriosis. And naturopathic doctors, Ayurveda practitioners, they do so much to support these conditions and can be really, really helpful. Knowing your field in general, your whole field, like what is happening in your constitution from a mind-body perspective, from the Ayurvedic constitutional analysis. I'm not going to go into too much detail about the constitutions today just because of time. And, as you might be familiar with, if you know Ayurveda, is that there is so much to cover in regards to the constitutions. But essentially what this outlines are your tendencies, your weaknesses, and also your strengths, and then how you can apply nutrition and lifestyle towards supporting your constitution and bringing it back into balance. Okay, and I also wanted to highlight here boundaries. So I think of boundaries as how you protect your energy. Okay, so thinking of your field as how you protect your energy, your vitality. And this is something that's always highlighted in Ayurveda, is getting to know your energy, protecting your energy, protecting your own resources, and refilling when you're able to. Okay, so this is, maybe you're engaging in self-care practices or meditation on a daily basis. Maybe you're going for a walk in nature once a week. What is both refilling you and what might be also kind of leaking your energy? Coming to understand what those might be. So an important aspect of caring for our uterus is understanding Ayurvedic menstrual care. And I think that this provides a lot of insight into supporting a healthy menstrual cycle, because most of the time, for those of us that menstruate, we know that we have to kind of keep going in the culture that we live in. And from the teachings in Ayurveda, it's suggested, when you're able to rest during your cycle, to please do, especially on the day 1 of your cycle. If you're able to rest on day 1 to 3, even better. This means maybe just not overscheduling, taking a nap if possible, going to sleep early, not engaging in strenuous exercise or anything that's mentally straining as well, if it's possible to arrange, for these kind of life changes. This can support your menstrual cycle. You also want to include warm foods. And by warm foods, I mean avoiding raw foods, avoiding cold foods, avoiding cold drinks or ice drinks. Having soups and stews and khichdi, if those of you, some of you might be familiar with khichdi, which is like rice and mung beans together. And you want to include lots of warm drinks as well. Okay, so you just support your whole system to go through this menstrual cycle process, which in Ayurveda also recognizes as being a deeply cleansing process as well. Okay, so thinking about how you menstruate and then what you can apply to support your menstruation as well, like some of these tips that you can apply. Okay, the next vital element of conception is healthy and nutritious fluids. This is referred to as ambu, another word for water. So this is really focused on healthy nutrition. Okay, and we also already talked about regular menses and regular ovulation and supporting that and trying to be proactive on caring for that as well if you're noticing that things are irregular. And you also want to understand your toxin exposure as well. Okay, so we'll go on to more detail. So I suggest, working on enhancing your nutrition with using maybe a simple Ayurvedic detox. This is not a panchakarma that I'm recommending. I know some of you might be familiar with that. I do recommend going for a panchakarma if possible before you conceive, receiving a panchakarma if possible. But, with what's happening in the world right now as well, it might not be accessible, right, in any way. So I usually work on supporting people that I'm working with, patients that I'm working with on fertility through a guided at-home Ayurvedic cleanse. This is really individualized for the person. So the dietary recommendations would be different for each individual. And we'd also be going through individualized herbs, specific tea that you'd be taking every day. And I really encourage working on reducing a toxin load that might be occurring in your life. So this is, eating organic when possible. And I recognize it's not always possible. So if possible, to look at Environmental Working Group, which provides the guidelines for the Clean 15 and Dirty Dozen. Okay, and I'll have a link in the PDF handout that you're going to get sent, the resource guide that you'll get sent. Okay, so I'll have some links to the Environmental Working Group there. And you also want to reduce toxins at home. So reducing toxins in your cleaning products, in your cosmetics as well. And one area that I find really key is also getting a water filter. Okay, so in your home, using a water filter that will help to reduce chlorine and fluoride and also help to reduce heavy metals as well that can be a burden on the system. You also should be conscious of avoiding heavy metal fish. And this should be throughout your process of working on supporting and enhancing your fertility throughout pregnancy as well, throughout breastfeeding. So avoiding heavy metal fish. And I will also provide a link to understanding a little bit more about that in the resource guide. And I wanted to also share that, those of us that go through really intense cramping month by month because of our cycles, we might have to sometimes use a pain medication. I just wanted to mention here that from a naturopathic perspective, using Tylenol can deplete a specific antioxidant that the liver produces. It's called glutathione. This is a really important antioxidant for detox, for protecting your body from toxins. And so, if you are going to use any pain medication, of course, discussing with your GP on this, but I would recommend avoiding Tylenol when possible. And of course, you're working on so many aspects of your health that hopefully wouldn't need or require any support for your pain, okay? Because it's not normal to have pain. And there's a lot we can do to reduce that. So working on your nutrition means reducing your toxins to strengthen your nutrition. So another point on working on your nutrition is also understanding what your blood work is. Okay, so as a baseline, if you're just looking at considering conception, if you haven't necessarily had trouble conceiving, because I would add even more labs onto this list if that's the case, if there's been miscarriages or if there's been a diagnosis of infertility. This is a really good starting point for anyone, is to look at your general bloods, your blood count, and your ferritin levels. So ferritin is your iron storage. And again, just to reiterate, is sometimes GPs will be looking at such a wide range. And, for naturopathic doctors, more from the holistic perspective, we are looking at more of an optimal range of ferritin. Okay, and this is a little bit higher than what is at the baseline. It's quite a bit higher than what is at the baseline there. And ferritin, having optimal iron storage, optimal iron in the body will be so helpful for supporting the pregnancy, preventing miscarriage, and also preventing early birth. Really helpful for the growth of the baby as well. An incredibly important nutrient to look at. Vitamin D levels. Again, another important test to do. This is something I think all of us at the clinic, at Orem Clinic, would be requisitioning quite often. It's a hormone. It's an important hormone and vitamin that would be often deficient here where we're lacking sun to help activate it in our bodies. Vitamin D is associated with good sperm quality and really good egg quality as well. And I always recommend checking, because it's not often one that in your general sort of lab work that a GP would do. So you could ask for it with your GP. You can also, of course, check in with one of us, check in with me at a 15-minute appointment. We can talk about that. Okay, and checking in with your thyroid hormone. So this is your thyroid stimulating hormone. This is an important one to do for fertility as well. If we, again, the range is quite broad for conventional medicine, but fertility doctors will also know that if it is above 2.5, this particular level, then there's more of a likelihood for miscarriage. So it's very important that we lower it below 2. There's a lot that can be done, including lifestyle practices that help to manage stress, that can bring that into balance. And there might be more required as well that could be discussed with your GP, such as going on Synthroid, okay, if needed. Zinc is a really amazing mineral that's so helpful for fertility as well, both for sperm, both for ovum. So helpful for sperm motility and quality. And zinc also helps for immature eggs to mature. And mature eggs will only ovulate once they're mature. So it's an important one to look at. And, again, it's not necessarily things that I would always supplement, but I would also be looking at your nutrition and where you could be getting this particular mineral in your food. Okay, and then any questions that come in, I'll have a question answer period at the end. So Ayurveda, the foundation, teaches that all disease begins in the gut. All imbalances begin in the gut. So even with fertility itself, we really do want to focus on our digestion. Okay, we want to build a strong digestion so our nutrients are as optimal as they can be. Okay, so our dhatus, our tissues, are as healthy as they can be. So the terminology Agni or fire as our digestive strength. And it's a key component of our overall well-being. So what I suggest is actually learning about the foods and herbs that are supportive for your own personal constitution. Okay, so this is what I do in practice. I really support people to identify what their constitution is and then apply dietary changes based on that. One simple tip that you can take away: always start the day with something warm, And, you know, one of my favorite foods and spices to use is ginger, fresh ginger. So taking like a 1-inch piece of fresh ginger, peeling it, grating it, letting it simmer in a cup of boiling water for 15 minutes and then straining it and drinking. You could add a touch of honey or maple syrup. Okay, and then I'm going to provide you with a few more suggestions on strengthening your digestion as well in the resource guide. And yeah, with learning about your own constitution, again, I can't highlight enough how amazing it is to be able to know, to be able to understand a little bit more about what your tendencies are, weaknesses, and strengths, and then applying these principles for optimal digestion, for good digestion to that. Okay. And lastly, we come to talking about the seed. Okay, so this is looking at both the sperm and the ovum. So important to mention that the ovum, the egg takes 3 months to mature from the ovary itself to become an egg that ovulates. Okay, so it takes 3 months time for it to mature. That means I do recommend a minimum of 3 months to do preparation work before you try to conceive. However, if it's ideal, if you can take up to a year to do a lot of rebalancing for yourself. And we have to keep in mind that the egg and the sperm is such small parts of our being, but so potent. They are sensitive, right? Very sensitive to environmental toxins. So again, I'm going to highlight in the resource guide how important it is to reduce your environmental toxin load. One important thing, there was a study done on non-stick pans and sperm. So this reduced the sperm motility and quantity in people that were using non-stick pans. Okay, so this is an interesting one in terms of looking at environmental toxins. Quite fascinating. So just always considering the toxin burden and how we can protect the seed, and knowing that of these 4 vital elements of conception in Ayurveda, they're also intertwined. They're all incredibly intertwined, and they're all just, again, a reminder to work on our whole health to really promote fertility. Okay, so again, these are the review of the 4 vital elements of conception. Consider timing, really getting to know our menstrual cycle and ovulation. We look at our field. Is there anything happening in our uterus and our ovaries, and what can we do to start changing that? We look at our fluids, our nutritious fluids, working on our nutrition. And we support our ovum and our sperm through reducing toxins and through taking care of our whole health. Okay, and I have some references here listed, and I'll also provide them in the resource guide that I'll be providing you. And I see some questions coming up here.
Yeah, there are a lot of questions. Thank you so much. That was really informative and helpful. And wow, I have a lot of thoughts. And so I feel like that was really helpful. For folks that have questions asked, we'll go through the questions in the chat. So
sure.
One person is asking, would you consider testing folate as well, or only after there are issues conceiving?
So I will always have people on folate that want to conceive. It's an incredibly important nutrient. So I do encourage taking a prenatal if you're planning on conception, taking folate versus folic acid. So folate is the natural,
Right.
the natural B vitamin versus the synthetic one. So it is really important to take a good quality one. And I always guide people on that. Where to choose and what to choose. Of course, you could take a good quality prenatal.
Oh, sorry.
Yeah, so it's not typically out of range. I will say that. Sometimes it can be low. Yeah, sometimes it can be low. But if you're having a generally good diet with lots of greens and lentils and things like that, you can get it to a good level, but we still want to have a high level of folate to be able to prevent neural tube defects. So I still suggest supplementation. So so I wouldn't say as a baseline to test it, no, just to kind of get to the root of answering that question.
That's super helpful. I think that relates to another person's question about the prenatal vitamin. But before that, someone else was asking if you can talk about recurrent pregnancy loss and how we would go about testing for that, and when you might suggest retesting hormones and other hormones after a DNC.
Yeah, that's a really, really good question. It's an important one. So I actually am addressing this in the resource guide. So if there has been recurrent pregnancy loss, so it's incredibly difficult to go through. And unfortunately, GPs may not have all of the testing required, or fertility doctors may not kind of take that functional medicine or naturopathic approach. So the testing that I suggest will be included in that resource guide. But I do always want to mention that checking in with autoimmunity, doing a more thorough thyroid check as well, looking at inflammatory factors. These are all really important to look at, even looking at celiac disease. So if there's a gluten allergy that hasn't been observed before or noted before, those are important to look at for recurrent pregnancy loss. And for retesting hormones after a DNC, I always recommend letting your first cycle come. Yeah, and then after that first cycle comes, then you could start the process of rechecking.
Great. Thank you.
Okay.
I feel like that's really helpful. Another question here. Can you recommend a good prenatal vitamin? What should it include? Brands? I think I already know the answer, but there are some limitations. Yeah, go ahead.
Yeah, so unfortunately, I cannot make a recommendation so specifically like that. It's such an individualized process that I go through. So I don't usually do general prenatal supplementation. When I prescribe supplementation, it's so based on your digestive strength as well. Again, from that Ayurveda perspective, that's a really important thing to look at. But I will say you do want to look at activated folate. Okay, so activated folate versus folic acid in your prenatal supplementation. That's a really important one to look at. And you can please book with me for 15 minutes. We can have a chat. And this is a complimentary session as well, just so I can kind of give you more details.
Yeah, I mean, that's very generous. I know there's a lot of limitations as a licensed naturopathic doctor in terms of what you can and can't prescribe. So it's not personal. It's for one's safety. I mean, I think, and for your practice, like, because you take such an individual approach, it's important that folks consult with their healthcare provider or get, just like more targeted advice, more specific to them as an individual. And then what amount, I guess my follow-up would be like, I hear a lot of things about 800 micrograms of folate in the supplement, and obviously activated being like, do you mean it has to be methylated? Or is it 1,000 microgram or milligrams?
Yeah, totally. Great. I like this question. It's always interesting to answer, but again, it's individualized. It should be a methylated folate. Okay, so usually we'll have a super long name. I think it's methyl tetrahydrofolate or something like that. Super long name. And then you do want to get a minimum of 800 micrograms. But I will say that I usually will suggest something a little bit higher. And especially if it's over the age of 35, we do want to go higher as well.
Right. That's helpful.
Okay? So it could be something even separate from your, yeah.
Cool, thank you. Yeah, that was for me. That question. So another question is excessive hair loss related to deficiency in reproductive health?
Excessive hair loss can be related to a few different things happening in the body. It's definitely showing that there is a deficiency. I mean, sometimes it can be hereditary as well. What I like to look at is if there's iron deficiency, if there's any thyroid imbalances as well. There could also be a B12 deficiency. Yeah, so a few things to look at and consider.
Fantastic.
And I think there's one more.
Just before I get to the rest of the questions, I know some folks have to peel off, but we will be sending out a link to the recording of this talk before we wrap up, and then, or in the next week or so, and we will include a resource guide that Dr. Sairupa has made and compiled for you with a lot of the resources and references that she was referring to today. So check your email for that for sure. If you have questions, you can book a 15-minute consult. And then also I will be putting it all on the Aura Medicine blog. So it's auramedicine.ca/blog. Okay, so let's keep going with the questions. Can low AMH be the only cause of recurrent miscarriages?
So having low AMH generally is signifying that there's a lower reserve of eggs and ovaries. So I just want to mention that. We do want to see that it is at an optimal level. I want to mention, and not everyone will say this, is that it can be changed. It can be increased. Okay, AMH can change. So sometimes it's a dynamic one, and we don't always get the education around that it can change. It may not be the only cause of recurrent miscarriage. And yeah, I do want to highlight there could be other things happening as well that just need to be looked at.
Great. And will the resource guide provide some things around diet to support fertility? Was another question.
Yes, it'll provide just some subtle things. I won't have a lot of recipes in there because, again, I do like to personalize and individualize those recipes for people. But I will have some really basic things that I spoke on today, things like, we do want to keep generally warm foods in our diet, warm drinks in our diet, and I'll have a nice tea recipe in there as well.
Oh, that's great.
Yeah.
Well, I love the ginger. I always use that ginger recipe.
Yeah.
I found this super helpful. I know there are a lot of healthcare practitioners here joining us as well. So yeah, I think there's one more question about IV nutrient therapy as well, and glutathione. They're if you've used them, if they're generally beneficial for fertility in general. Have you encountered that, glutathione?
I feel like this is a question for another one of our practitioners or who does IV nutrient therapy. But I will say that, for glutathione, as I mentioned, because it's so supportive of helping with detox,
right,
it could be helpful if there is a toxic burden, that could only be identified when you do see a practitioner for that individualized guidance as well. And if you are seeking out IV nutrient therapy, we do have that as well at the clinic with Dr. Vivian. Yeah.
Well, I think I mean, yeah, like that. I mean, if I may comment, the glutathione part, even if you're taking it orally, I think it's important that folks are under the care of someone if they are pushing detox, or I guess advanced depurification, as Dr. Tanya talks about it, because there's an order that we have to go in term when we're detoxing, right? We see this all the time that sometimes people over detox, they get Herxheimer reactions, or it's not suitable for them to be doing it. So we can't really generalize when it comes to the glutathione for fertility in this case, but it could be a big part of the fertility support, is what I'm hearing from you.
Yeah, absolutely.
Yeah, great. And then there's one last question on using NAC with someone with Tylenol use. That is the gold standard, isn't it? Treatment for Tylenol over.
Yeah, absolutely. It's a helpful one. It's a helpful one to use, but again, I always recommend that's an important one to use under the guidance of a licensed practitioner as well.
Yeah.
For NAC. Yeah.
Great. Well, thanks so much. I think that was really helpful. Thank you everyone for attending and for sharing your questions and staying on with us. We'll be emailing out a link to this video if you wanted to go back and review anything. And again, emailing out a link that will have a way for you to download the PDF resource guide after the talk. So just stay tuned on your email. And again, really appreciate y'all joining in the middle of the day. And Dr. Sairupa, thank you so much. This was fantastic and really helpful.
Thanks so much, Dr. Julie. I appreciate it. And thanks to everyone who came. So I look forward to hearing from you. Take care.
Okay, take care, everyone. Bye.
Bye.